I'm Jeanne Noble, and I've worked at Mercy Medical Center for 40 years, a little over 40 years now. It was 40 years in May.
For 4 decades, Jeanne Noble has graced Mercy and her patients with her presence. Jeanne started at Mercy as a bedside nurse in the inpatient oncology unit and was there for 22 years, always learning and soon teaching others.
As part of that, I was also a nurse clinician, which expanded things to educating staff, educating other patients, and things, being more like an oncology clinical expert.
An expert she is. In her career, she served as inpatient nurse manager on the oncology unit, shift supervisor, then manager in the healing center, where she assisted with chemotherapy and blood transfusions after hours for outpatient treatment. Also, nurse manager of the chemo infusion team in the cancer center, followed by manager of Mercy's clinical oncology practice in the then new Hall Perrine Cancer Center. And now she's rounding out her career in clinical research. Caring for cancer patients in one way or another has always been her calling.
Most people, I would always ask me, why are you in oncology? Because it's so depressing, isn't it? And I say, no, it's an honor. It's a privilege to be part of someone at some of the most vulnerable and intimate times of life, especially when you think of end of life.
Medical oncologist Dr. Deborah Wilbur has worked with Jeanne for the past 20 years.
And she has always brought an amazing amount of knowledge, calm, competence. Always somebody who was just willing as a manager to be a true working manager who would just roll up her sleeves and get in there and lead by example. Just call her and she would drop everything and show up. On a weekend, she wasn't supposed to be working. At a time, she wasn't planning on working. And not complain. Not complain. Happy to do it. I mean, she really is the best. She really is the best.
During Jeanne's time at Mercy, she's seen amazing advancements in cancer care. One of the biggest changes, she says, has been the shift from inpatient treatment to more outpatient therapy, allowing patients to work and continue their routines with less disruption. In imaging at Mercy, she recalls when a CT scan would take an hour to administer. Now, the test is much more advanced and takes just 45 seconds. In radiation therapy, lead blocks were once used as a barrier to prevent radiation from reaching healthy tissue. Now, Mercy has advanced tomotherapy and linear accelerator machines that precisely adjust the radiation beam to the exact site of the tumor at that very moment, sparing healthy tissue. And Jeanne has most closely seen and experienced the evolution of cancer medications, from chemotherapy to adding targeted therapy and immunotherapy.
During her career, she's seen the evolution of whole other types of medications with far fewer side effects. For example, immunotherapy has just really revolutionized medical oncology care over the last decade. Medications that just get our own intrinsic immune systems, these systems that are supposed to fight off infection and cancer for us, just makes them work better and has far fewer side effects.
And Jeanne says it's been so rewarding to work in clinical research and see where the future of cancer care is headed. Dr. Wilbur says Jeanne has been an amazing asset to Mercy's research team.
I mean, her reputation statewide, nationally, in the research realm it's great. And she's just such a wonderful, calm, mature, professional, loving presence. I mean, that's who Jeanne Noble is.
Recently, Jeanne was nominated by a patient for a Mercy Touch Award for going above and beyond, like she's always done.
It's very humbling. Brought tears, and to think about it brings tears to my eyes. I don't ever do anything with that kind of intent. I'm never seeking awards, rewards.
Never seeking rewards herself, but always encouraging, educating, and lifting others. Over the years, Jeanne found nurturing and creative ways to help those around her.
Oh, yes, something I created. The insulin pen poem. I, over the years, have written several different poems and limericks because I I do something quirky, it tends to get remembered. Insulin, insulin in a pen, used for just me again and again. Changing needles does not mean it's safe to use among the team. If the pen gets shared by two, an exposure was just caused by you. Now you have reports to file, labs to draw and reconcile. So heed this warning here, my friends. No more backwash from insulin pens.
Jeanne is one of a kind, and she will most certainly be missed. And Jeanne says she will miss Mercy.
First, gratitude. Gratitude to Mercy for taking care of me and helping me grow and answer my calling, and hopefully, and taking care of patients, and hopefully I've been a good person for them. And it's sometimes very humbling to see all the lives that I've touched when I didn't think I was.